Thank you, Mr. Speaker. My question is to the Minister for Health. You met with representatives of my community at Bowral Hospital about their disappointment at the planned upgrade. You said we could work towards a clinical services plan. Why is my community being offered a business as usual plan and not a new clinical services plan?
Minister.
Well, don't I mean that's stupid. To go, let me walk through. I'll make it. Look, I can't draw it, so the Nationals will be a bit hard to do this. But
You can't bring it
I'll write it like it had been. I'll do my best. Firstly, can I thank the member? I think everyone in this place would agree she's a fantastic advocate for her community.
Member for Coffs Harbour.
Community that is undergoing extreme challenges in relation to growth, and she has a range of different centres. I know the Minister for Planning is dealing with a range of issues in and around that area, and this is a member who's a fierce advocate. I do want to acknowledge the Nurses and Midwives Association who are in the chamber today as well. Can I say that the current clinical services plan, and just for people's understanding, clinical services plans are plans that we look at to make sure we're catering for the current and future needs of a particular area. In this case, obviously, in and around that Bowral region. The current clinical services plan was updated in 2021. It goes out to 2031. Can I say from the outset that I'll be making contact with the CE of South Western Sydney Local Health District, Sonia Marshall, fantastic local chief executive, and lining up a time when the member and community representatives can be updated on that in more detail. That is something that I certainly expect from local CEs. It's certainly what the Minister for Planning, myself, the member for Heathcote, and the member for Shellharbour get in our local health district in terms of access and updates. So that is important. Can I say in relation to that hospital, it is a very challenging piece of infrastructure. Now there's a $55 odd million stage 2 development that's currently underway. That'll wrap up towards the back end of 2025, I think it is from memory. It's a challenge because that hospital is around a 100-year-old facility. So I think all of us can imagine the type of challenges and what we're doing there. There will be a considerable investment, and there is a considerable investment that has continued from the former government into our government into that space, and that is going to continue there. One of the challenges that we've identified in the clinical services plan is making sure that the plan reflects the need for more virtual care to take place in and around that area. The local member and also residents who I met with, and I've had a number of discussions with in that area, have talked to me about some of the challenges having to go from places like Bowral into the larger centres in places like Campbelltown.
Member for Wallandilly. Additional 2 minutes is granted.
To Campbelltown, to places like Campbelltown. Now, ironically, in some degree, this is a bit of an anomaly in that relation to that local health district. Bowral forms part of the South West Sydney Local Health District. Now, that's a challenge sometimes, simply because we operate a network system of hospitals. That means within our own hospital network, down in the Illawarra, people get moved around various different hospitals depending on their clinical need. Yep. That happens in southwestern Sydney as well. The challenge for the members' constituents, though, is a real one in relation to that being a significant travel distance, and also those hospitals. Member for Campbelltown and the members in southwestern Sydney will know all too well that Campbelltown is one of the busiest hospitals in Australia at the moment. So I think we do need to do more in relation to Bowral. I am happy to engage again directly with the member and the chief executive of the local health district. I want to make sure that the community understand that I can see how there is some challenges in that part of the world in relation to accessing healthcare. I can understand that. It is real. We will work through that. We are working through the $55 million redevelopment, and I know that a range of different community consultation has taken place in relation to that, whether it's online, whether it's walk and talks, a range of different forums. But I don't say for one moment that we get that engagement at all times perfect, by no means. And if we need to do more, if we need to have a refocus on the clinical services plan, if we think it needs to be updated, then we can certainly have a look about that. But in the short term, what I want to prioritise, as I would for any local member, is to make sure that they get direct contact with their local health district chief executive. They are responsible for the delivery of some of these services, and I'll make sure that that's put in place for the member for Wallandilly.
Thank you.